Good morning. Welcome and thank you for joining us today. My name is Sean Evans. I'm with the Meridian Chamber of Commerce. And we're happy today to bring you a program that the Meridian Chamber of Commerce, in partnership with the City of Meridian and Central District Health, Crush the Curve Idaho, and numerous partner organizations and individuals are proud to share with you that will assist Meridian businesses as they reopen for business. Our campaign will not only educate businesses on the basic guidelines to reopen based on Central District Health and CDC guidelines, it will also allow businesses to demonstrate to the public that they're doing so in a manner that will keep Meridian healthy and open for business. Online and speaking with us today are just a few of our program supporters that have helped develop this program for the Meridian business community, as well as local businesses leading in best practices when it comes to safely reopening. So we have with us today Joe Antonucci, program manager with Central District Health. We'll have someone from Crush the Curve Idaho, Tina Upson or Amy Stahl with Salsa Health, Crush the Curve Idaho, and our planist, Dr. Michael Karlfeldt with the Karlfeldt Institute, and Dr. John Kaiser, the Chief Medical Officer with Salsa Health. We will open it up for questions at the end of the presentations. You can enter your questions in the chat, the question window at any time, and we will get to those at the end of the program. The premise behind our campaign was getting businesses back and open and restarting our economy. That's why this group was started. We initially pursued efforts to get everyone open as early as possible, but we also saw the bigger issue of reopening amidst the COVID-19 crisis, and that was, will the public return to the stores or establishments when they reopen? We're contacted daily by our business members on how does the governor's plan apply to my business? When can we actually open? And what other guidelines does my business need to follow? While the Meridian Chamber of Commerce is not an authority on this plan or the recommended guidelines, we are here to help the Meridian businesses understand them better. The last thing we want to happen to our local businesses is that they go to the effort and expense to open, bring back employees, restock their shelves, and the public, the consumers, not visit their establishment out of the fear or concern for their safety. The Central District Health and CDC have developed some guidelines to reduce your risk when out in public, and if businesses can follow these guidelines as they reopen and demonstrate to the public that they're serious about the public safety and health, then that will build the consumer confidence necessary to restart our economy. The Meridian Chamber of Commerce has launched Keep Meridian Healthy and Open for Business to help our businesses build that consumer confidence. As businesses open according to the governor's 4-stage Idaho Rebounds program, we will assist Meridian businesses by conducting industry-specific webinars like this one that will provide information from the Central District Health and CDC on the basic guidelines for that industry. The webinars also feature local business leaders that have taken even further steps to ensure that they are reopening in a safe and responsible way. After the business participates in the webinar for their industry, they'll be provided free of charge collateral materials to display in their store that recognizes them as participating in the Keep Meridian Healthy and Open for Business campaign. These materials include door signage, stickers to show that they're part of the campaign, posters for in-store display that touch on the high points of the general guidelines about health monitoring your employees, enhanced cleaning, wearing face coverings when you're in direct contact with customers and unable to maintain the 6-foot distancing recommendations, encouraging customers to use touchless payment methods, and then of course, proper respiratory etiquette. It also includes social media materials that you can use to share and show that you are participating in this campaign. And then it will also include you listed on a website and our marketing campaign as a business that cares about the health and safety of their patrons and the public. Our program goes beyond what some other communities are doing by just creating a list of businesses that are complying. We are helping them understand what it means for businesses and sharing best practices from other industry-specific leaders. The guidelines are out there that are not a one-size-fits-all solution for every business. We don't know what we don't know. These industry-specific webinars seek to educate beyond a sheet of paper and written guidelines. Educating businesses on the additional protocols they can implement for their specific type of business is where the value of our program comes in. And that value is communicated to the safety for your employees and customers. To be in compliance with the governor's 4-stage plan, businesses will only be provided collateral material when their business is scheduled to open according to that plan. Also, following up after opening, the participating businesses will be encouraged to answer surveys from the Meridian Chamber on how their opening is going and the sentiments from their patrons returning to the stores and businesses. This will assist us in phase 2 of our program as we build out a business revitalization team to support the Meridian businesses. Look to the keepmeridianhealthy.org website to see a full schedule of industry-specific webinars in the coming weeks. With that, I'd like to turn it over to Joe Antonucci with the Central District Health to share with you the guidelines for general businesses and maybe medical service facilities that are able to open as of today.
Okay, thanks, Sean. So like you said, my name's Joseph Antonucci. I work here at Central District Health, and I'll be discussing with you guys, the practices that or recommendations we have for medical facilities that are going to be opening here in the city of Meridian. Many of the medical services may have already been open or may be doing minimal services or in some manner reduced services, in part because of obviously the whole COVID-19 pandemic that's going on. Even though businesses are reopening and more people are going out, COVID-19 is still out there, and everyone knows that. Just be aware that at some point it could possibly enter a facility, and it likely will enter a facility, and you guys just need to be prepared and anticipate that sort of scenario from in case it does happen. In part because of this, federal guidelines and our guidelines are still recommending people do telehealth if that's at all possible. However, many services cannot be provided through telehealth, and that's totally acceptable, but it is still recommended that be the preferred. That way people aren't interacting as much and putting themselves at risk. One of the other things we've seen is many businesses that are medical businesses, especially in lieu of having actual waiting rooms, we're actually seeing that some places are doing in-car waiting rooms, and that could really go for any sort of business where people may be waiting. It decreases the need to socially distance people in there, and instead of waiting in the rooms, they're able to wait in their cars and then get a call from the facility itself to let them know when they're, the doctor or whomever is ready to see them. That's a very good option. But because COVID is still out there, and even if you're doing that sort of practice, there are recommendations to have or for people to consider establishing what are called non-COVID care zones. So as they enter the building or as they enter the facility, that people screen patients for symptoms of COVID-19, which includes temperature checks, and that staff as well would also be routinely screened as they are going to enter and work in the facility. Anyone coming into a facility really should have a face covering that includes the staff members as well as the patients or customers that would be coming in. That decreases the chance, as everyone may already be aware, of spreading the disease by controlling it at the source, and it eliminates that possibility of it going to the other folks who, even though they might have masks on, it helps protect it. And we do recommend that everyone in these sort of close contact businesses do wear a mask, whether it be cloth or for the medical team, maybe a more higher grade N95 mask. With that said, you should be prepared in case your type of business does offer service to people that do have COVID or are suspected of having COVID. So you should have that plan for that in place on how to handle those sort of folks. Obviously, healthcare settings, there's lots of guidance from the CDC and from other sources, CMS as well, on how to handle patients that are actively experiencing or suspected of having COVID-19. And it includes things like face shields, N95 masks, gloves, gowns. All those precautions should be taken. As you may be aware, healthcare workers are at a higher risk of getting COVID-19 from people that have COVID-19. I mean, that's pretty obvious, but be aware that your services that you guys provide, you may not have the same sort of option as other services might have, asking somebody not to come in if they're experiencing COVID-19, because they still may need medical services that you offer. So be prepared to handle that in the event that you do have COVID-19 patients. Obviously, we'd recommend having signage out front or making them aware somehow that they should be notifying you if they're having symptoms or if they're diagnosed with having it. And really the same sort of thing is true for other maybe other businesses that may not be offering the same type of medical services. You guys should also have signs out asking people not to come into the business if you're experiencing those symptoms, or if they're experiencing those symptoms. All businesses, of course, no matter what they are, we're recommending people do social distancing, of course, whether it be in the waiting room or anywhere that is possible. However, a lot of these businesses, that's not a option because it's such close contact. And so, in that case, the signage goes a long way to let people know they shouldn't be there, and that if you're going to do temperature checks on customers, as that should also be noted somehow, letting them know if they come in due to the nature of the business that you may be wanting to do temperature checks on them, if that's going to be something you're going to do. You should also ask that people not bring anything that's unnecessary into the business with them, as far as, extra people, or if they don't have to have another person there with them, or to limit the types of items that they bring in with them, just as a precaution. As far as sanitizing goes in the business, a lot of these businesses are going to have high contact surfaces, and we do, recommend doing proper sanitization for those sort of surfaces, especially things like doorknobs, light switches, bathroom areas, faucets, or anything that's constantly touched in a high traffic area. And we do recommend using EPA registered disinfectants, and those can be found on the EPA website. I believe they have a whole section dedicated just to sanitizers that are effective against COVID-19. Because the businesses are usually higher contact businesses, meaning they're really close with people, we do recommend utilizing glove use, of course, and then a minimum face cloth coverings, especially if you're unable to maintain social distancing, which a lot of these businesses, that's not real possible, of course. And you should be discouraging sick customers or people who think they're sick from coming in to help prevent that, especially given the nature of the businesses. If somebody were sick and they were to enter the facility and you're doing whatever services you're providing, likely you're going to be within 6 feet of them for longer than 5 or 10 minutes. And that dramatically increases the chances of somebody contracting COVID-19 if the person they're in contact with has it, even if they are wearing things like a face covering or a face shield. But so the best way to prevent it from entering your facility is to literally prevent it from entering your facility, but it may still make its way in there. Something else we're encouraging is, coming up with possibly a new process for handling payments and receipts, going, cashless and doing electronic payments and receipts. That's always a good idea to lower the possibility of handling cash and the close interaction with folks. And then, of course, we do recommend you give your employees some sort of training as to everything that's going on with COVID and signs to look for, and making sure they're not coming to work if they're having things like a cough and a fever, or if they've been around somebody else that's tested positive for COVID-19. Healthcare facilities, unlike other businesses, if you are an actual healthcare facility, there are requirements for healthcare workers as far as returning to work if they have COVID-19, and you can find those on the CDC's website for healthcare workers returning to work. Typically, it's recommended that they get negative test results before they can return to work in a healthcare setting. But like I said, you can find that on the CDC website to see what those recommendations and practices are. And also, we recommend all businesses be more lenient with time off and sick leave, because you don't want to have a staffing shortage for whatever business you have. If people are really concerned, like they heard somebody there had COVID, now they want to call in sick because they don't want to work with them. You don't want to give people a reason to call in sick and put your business at a shortage, a staffing shortage. And so with that, that's pretty much everything that I had.
Joe, thank you very much. Great guidelines, and we appreciate you being on here today.
Okay.
Next, I'd like to introduce Amy Stahl. Amy is with Salzer Health and is representing Crush the Curve Idaho right now. So Amy, would you mind sharing a little bit about Crush the Curve Idaho and what you're doing on the part as far as providing employers testing options?
I'd be happy to speak on behalf of Crush the Curve Idaho. Thank you, Sean. And thank you for the work that the Chamber is doing to keep Meridian healthy and open for business. The campaign is really helpful and provides a lot of great information for businesses. We know we're all anxious to get open, but we want to make sure that we keep our community safe and healthy. In terms of Crush the Curve Idaho, as a representative of Salzer Health, I'm speaking to you as the medical partner in the Treasure Valley. Crush the Curve is a statewide initiative. There are other campaigns going on in other cities, including Pocatello and Idaho Falls, and expanding to Lewiston. So we are working hard to reduce the spread of COVID-19 by increasing the ability for testing for COVID as well as antibodies. This is a organization of business leaders, innovators, and other organizations working together in a nonprofit to provide the testing that we know will help Idaho get back to work. If you could advance the slides. Thank you. So our goal is, as I mentioned, is to provide PCR tests. Those are the nasal swab tests that are used to detect COVID-19. And we are offering that to symptomatic and asymptomatic members of the public, and providing results through an online patient portal. Currently in the Treasure Valley, testing is occurring for COVID testing is offered at Seltzer Health's urgent care clinics in North and South Nampa, and by appointment at a temporary location at 10 Mile Crossing at 10 Mile and I-84. Next slide, please. Antibody testing, which is a test, it's a blood test that is done to detect if an individual has had COVID-19 weeks prior, is also conducted at the 10 Mile facility. It's a very easy blood test. We are making appointments and working closely with businesses to provide the testing as an indicator of whether your employees have had COVID-19. We also consider it to be a very important piece of data that helps make important business decisions in terms of determining community spread and our ability to get more businesses open and our employees back to work. Next slide, please. In terms of the employee testing, we want to make that available to you, to businesses. You can apply on the crushthecurveidaho.com website and initiate the process. You'll be in touch with members of the Seltzer Health team who will help you form a partnership, work with your insurance companies, help the employees do the paperwork and get the information into the patient portal. It is a secure, confidential portal that the patients can access to determine the test results. The tests do entail a cost. As I mentioned, some insurance companies will cover the cost. The virus no swab test is $95 and the antibody test is $105. We do bill insurance and companies will be responsible for unreimbursed costs. So we can explain that as part of the entire process for engaging your employees. And I look forward to hearing your questions at the end of the presentation. I hope we'll be joined by Dr. John Kaiser, the Chief Medical Officer for Seltzer Health. I did also want to reiterate what Joe and Central District Health are pointing out. We are following CDC guidelines, and we encourage you to educate yourself on their awesome website for more information about how to protect both your employees and your customers. Thank you.
Thank you, Amy. We appreciate the partnership with Crush the Curve Idaho on this effort. Next, I'd like to introduce Dr. Michael Karlfeldt. And one of the most important things about this program that we're doing is having the business leaders, the industry people within the sector talk about what they're putting in place as best practices within their own organization so that people can learn and we can all work together to help get through this time. Dr. Karlfeldt, turn it over to you.
Thank you so much for having me. Yes, I run a integrative health clinic where we offer both holistic therapies along with medical therapies. So we have a number of different practitioners at our center, and the steps that we've taken to make sure then that our patients feel comfortable to get back and utilize our services. We've gone through, asked a lot of other medical facilities and, communicated with the representative here, CDC, of what would be some good steps to do. And so during the process of for about a couple of weeks, before May 1st, we did mostly just telehealth. And anyone that needed nutritional supplements or any kind of products, we would then offer them curbside service. So a patient would then drive up. We would have signs on the building and on the doors, to not enter into the building. and then with our phone number so that they could call, and we would then answer here and then provide then a curbside pickup, where we would provide them with whatever supplements or substances that they needed to support their health. So, and we have then, taken great care. Obviously, the staff we're required to wear a mask, in all patient interactions, and also then patients are strongly encouraged to wear a mask. And if we see any kind of indication of that the patient is having any cough or anything that is concerning in any way, we then request that they wear a mask. And every patient, before they enter into the building, we go through a screening protocol where we do check their temperature, and any temperature above 100. I know the cutoff has been set 100.5, but we want to just be a little bit extra cautious. So anything above 100 or any kind of acknowledgement of a recent exposure to COVID-19, or that they are dealing with any kind of symptoms in any shape or form that could be related to COVID-19, we would then ask then the patient to reschedule the appointment then at a later time. And we've also restructured the flow then of how patients are being seen, so that we minimize the amount of patients in the building at one time, and so that we can then ensure then the 6-foot distancing. We put marks on the floor so that patients are aware of where it'd be good for them to stand in order to be able to so we can have payment interactions or product exchange. We're still offering the curbside pickup so that we only have a small amount of patients within the building at the same time. We've closed our lobby so that the parking lot has then become the lobby. When the patient arrived, they will then let us know. They will call us, will let us know, and that way we're aware of that they are here. And when it's their time, the screener will let them know, come to the car, let them know, and then go through the screening process. Also, we wipe off any kind of surface where the patient has been. So we wear gloves when needed. We also wipe off any kind of high touched areas, like in the bathroom doors, counters. We also use purifying different substances out to kind of purify the air. We use substances to clean our hands, anytime we touch anything. And see if I'm missing anything here as well. Yeah, so these are steps that we have taken, and the main thing is then to make sure that our patients, that they feel comfortable to enter our environment. And obviously their patients and people are at different parts of the spectrum. There are some that are highly concerned, and then there are others that are not as concerned. And we want to make sure that the full spectrum of people feel comfortable to be able to visit our establishment. We do offer also antibody testing. It's just a little blood test. We offer that for a certain amount of patients. It's not as thorough as what Crush a Curve is doing, but it's just kind of a nice antibody test that is known to be about 96% accurate. So it's just a little extra service that we offer here at the center. And yes, I'd love to answer any questions at the end when we have a Q&A.
Dr. Karlfeldt, thank you very much. We appreciate you participating today. I hope we have Dr. John Kaiser, with Chief Medical Officer of Salzer Health. I do see him on there as a panelist. Dr. Kaiser, are you available to talk?
Yes, I'm on the phone. Can you hear me?
Yes, sir. Go ahead.
Okay, great. Yes, thanks for having me join this webinar. I appreciate the opportunity, and I'd like to just run down a few things that we are doing at Seltzer Health in response to the COVID-19 pandemic that we're all experiencing and learning through. Some of the actions we took early on is we set up some of the earliest curbside drive-through testing for COVID-19 PCR testing. And we did that back in middle March to early March timeframe, and we did that for a couple reasons. One, we started to see more patients in our urgent care locations that were starting to have some of the symptoms that we were concerned for COVID-19. And so by utilizing the drive-through process, we were able to decrease our PPE use, which the supply has improved, but was a significant shortage in the beginning. And it also protected our providers. We initially started with screening each of them and doing influenza testing, then waiting for those results, and then testing for COVID-19 so we could eliminate any other potential causes for it. Also strep testing for strep throat. As those other two diseases, influenza and strep, subsided in the community, we went to just COVID-19 testing. We have used always labs that have been approved under the FDA EUA authorization and continue to do that testing at two of our locations, and we had a third location that we closed when we opened the 10-mile location. We also used expanded telehealth visits very rapidly. Within about 3 days, we were able to bring that up through our electronic health record and converted as many of the visits as we could to a telehealth visit for our patients to continue to have access to their providers while preventing exposure as much as possible. Next, we also implemented a phone triage process. So when patients who couldn't be seen by a telehealth visit were scheduled for office visits within the clinic, they were screened before their visit via telephone call asking for any of the symptoms that might be associated with it. If any of those symptoms were identified, they were then sent to a nurse triage process who further clarified what their symptoms were and then referred them onto our curbside testing if it was appropriate. If they had none of those concerns or issues that we thought might present a problem, then they were asked to come to the clinic without visitors. At the clinic, we closed our clinics to a single entry location. We initially did symptom questioning as they entered the building. Any symptoms, again, if they were positive, the patient was asked to return to their car, given a mask, and asked to call another number, again, triaged and sent to the curbside testing location. If they then after that, we implemented also temperature checking for all of our patients and staff at the single entry point. Once they were entering the clinic, we have limited schedules so that we don't have more people than needed within the clinic space. We see those patients. When we see those patients, we use proper PPE. We have given masks to all of our patients as they enter the clinic also to help protect themselves and our staff. We have moved as much of our business to remote working with setting up VPN and other connections for our staff members to keep them out of the clinic as much as possible. We also have expanded use of PPE as we've become more available to us as providers. We quickly eliminated all procedures that were done within the clinic environments where we thought there was an increased risk to our patients. We are slowly restarting those with taking all the precautions that the representative societies recommend. For example, GI, we had a GI clinic and we eliminated those. We'll be restarting those in a couple weeks, but with that process is restriction of which patients and a triaging of which patients need to have that done to help the benefit will outweigh any risks. All those will also have COVID-19 testing before the procedure is done to help eliminate risk to them and also identify any COVID-19 positive patients, as well as protecting our staff. We also increased our cleaning of the clinics throughout this process with 2 to 3 times a day high contact surface cleaning, and then of course at night each day for all the clinics. Some of the clinics are within other health facilities, and sometimes that work is done from the agency that we rent the space from. Next, we also participated, as Amy was mentioning, with Crush the Curve Idaho, and we have provided the COVID-19 PCR testing, as well as partnering with the University of Washington for IgG antibody testing, looking at what the disease burden in the community has been in the Treasure Valley. And we are assisting in some of the other locations in the state for providing that test capability. When we did that, we opened up multiple tents at that 10-mile location, as Amy mentioned, did a significant number of tests on a large amount of the population in the Treasure Valley, and I think provide meaningful information to the community on what the disease burden is in our state. And we will continue to make changes as this all unfolds, and as we learn more about this disease and what are the right things to do. And we look forward to working with everyone, all of our business partners, in helping to make this transition as safe as we possibly can and provide resources to the community.
Thank you, Dr. Kaiser. With that, I would just remind you that you can enter a question in the chat or the question box if you are an attendee. Don't see any questions now. I think we had some very, very valuable information shared from the Central District Health and some of our businesses on what they're doing when it comes to medical services and how they're looking to open things back up. Let me double check the questions again here. Doesn't look like we have any. So with that, I'd just like to thank all of our panelists, from Dr. Kaiser, Dr. Karlfeldt, Amy Stahl with Sulzer Health, Crush the Curve Idaho, and Central District Health for participating in our webinar today. This webinar will be made available for anyone from this industry to view shortly. And just thank you all for helping spread the word to all Meridian businesses that we're here to help them open in a safe, responsible way. I want to keep Meridian healthy and open for business. Be sure to answer the follow-up survey that we'll be sending you and being able to get you the email and collateral materials starting today. Visit keithmeridianhealthy.org for more information on the program and to sign up for future webinars. Thank you again to our panelists, and have a wonderful weekend, and keep Meridian healthy and open for business. Thank you.
Thank you, Sean.
Thank you.
Thanks.